I spent a couple of very happy years working in Kilifi and setting up the trial facility. And in fact, much of what we've done with the Global Health Network built on exactly what's going on in Kilifi. And the ideas that Sam explained to you about trying to share across different disciplines and different disease areas. And effectively everything you're going to hear now is just an online version of what's happening in Kilifi. I think that's a fair description, isn't it, Sam? So thank you for the introduction. There's a bit of feedback on these mics. Those of you in the audience who work on any form of clinical research study should appreciate this very well, that anything you do when you run a study isn't actually that different. And I often challenge, especially when I do training courses with a mixed audience, I challenge people to tell me only one thing they do in their clinical study or clinical trial that is unique to their study. And there's usually a few hands up, and it's usually things like, oh, our sort of lab assay is really special and nobody else has to solve a problem like we do. And then you dig down a bit and the problem was about labelling or QA or transportation, and it's completely, could be completely replicated. So really what I'm saying is that so much of what the things that we find difficult when we're trying to run studies well are shared, and it doesn't matter what disease we're working in, it doesn't matter whether you're working in a shiny hospital in London or in some of the difficult settings that we work in sub-Saharan Africa. We face very similar challenges. And simply what we're trying to do is suggest that if we've got better as scientists at sharing what we do and sharing our methods, that we could speed up a lot of the research challenges that we have before us that you've heard all about today. And if we as scientists got better at sharing the how-to, there was a nice clip on Natalie's slide, I think, about doing the how-to, that we'd be able to standardise what we do, and then we could share the data later. We'd share best practices rather than continually reinventing the wheel. And it would be immediately bring this collaboration and networking that we've been talking about. So this is really about how to put this into practice. And a few people have used the phrase community of practice today, and that's entirely what I'm talking about here. So community of practice, there's a nice academic label and whole school of thought about this that was really coined in Harvard. And a community of practice is a group of practitioners that share the same issue. So we're all trying to improve research in low-income settings, and particularly in neglected tropical diseases. You get those people to work together to solve the problem. And it's, in this case, we want to apply it to speeding up research in neglected tropical diseases. So a few years ago, we brought some of these ideas together. And as I say, it's really started from setting up an area for clinical trials, which we pretty much made an online version of the clinical trial facility we had set up in Kilifi. That went really well. It just was phenomenal. It took off very quickly. And so several groups, including Jeremy, who was here this morning, came together and said, I'd like one of those too. So we just replicated it, linked them all together, and thought, we've struck on something here. And it's effectively a science park for research. And all it is a space online to do your work, to talk to each other, to find collaborators. But we're just trying to apply the best digital technology that we can find. So when you go on Amazon or on your online shopping and it says, you've bought this book, surely you'd like this one. You're like, damn, I do, and you buy it. It's that, it's been, everybody uses Facebook and LinkedIn and everything else, but we've never really harnessed this technology for speeding up research. So that's simply what we're trying to do. And I am no digital expert at all, and I think that helps. And we employ very smart youngsters who do the clever stuff. But we're just simply trying to apply that cutting-edge digital technology and make it work to support sharing the how-to in research. So that's essentially what we're doing with the Global Health Network. So this has been built up over the last few years. We're largely funded by the Gates Foundation. And now it's quite a sophisticated platform. And if you think of it like a science park, we've got offices, digital offices where you can go in and work on influenza or malaria or tuberculosis or dengue, whatever it is. And you can go into that office and you can just share protocols, develop SOPs, discuss what the endpoints you should all be measuring, very important, you should all measure the same endpoints. And then you can step out from your specialist office and you can access the cross-cutting things like microbiology, diagnostics, regulations, ethics applications, how to write a consent form. Data management is a massive area we're getting into, and data sharing, which we talked about earlier. And then we've got quite a few research tools that I'll come back to in a minute. So there's over 20 of these independent offices on the Science Park now, looking at all sorts of different particular things. And we've just set up one for neglected tropical diseases, which we're working on with WHO TDR have led this space. So go on and have a look, and you can have a look at all the different ones. And this is the one we've just launched for neglected tropical diseases, and it's being coordinated by Astrid, who's sitting over here. This is led by Piero Oliaro at WHO TDR. But you'll notice that there's no logos on this platform anywhere. You know, this isn't about any particular organisational group. The reason we think this is working very well is that it's an absolutely neutral and democratic space where people can come together, they can set up their own groups, you can set up your own workspaces, you can have them open or closed, you can write a protocol, you can write a funding application. It's basically a space that's there for using as you need to use it. And if you think of it as a science park analogy, you can set up your own office, you can call in a team of people, get some work done, but then you can access everything else as well to get to that you might need in order to write a good protocol and guide your research. So the stuff that's up there now is just supposed to be showing the way and just giving some illustrative examples. Astrid's done a lovely job of starting some to get some resources up there and start some discussions. But feel free to dive in and get involved and pick it up and take it and use it as you want to. And we're going to do quite a lot of outreach activity through WHO TDR and anybody else who wants to get involved to really let people know about this and just make sure that people know it's a space that people working in this area can use as they want to. And it's a blank sheet. It can be taken, adapted, and developed as you want. The Gates funding that we've got enables us to build new digital tools. So if there's things you want on there, things you think it could be done differently, it can be done. And I'll come back to things like e-learning and process mapping in a minute. But it's there for the taking, and this is a whole new space just for NTD. So please do use it. This is just an example of how it's worked very well in another field. This is a group of people who work on influenza, and they've developed a whole raft of protocols that they've developed in consensus on here using the document development tools, and then they share them, and they're being rolled out all over the world and taken up and used and adapted. So they've got a standard protocol. It's taken by one group, adapted to their setting, it goes through the local regulatory approval, and off it goes. And it's been a very fast and efficient way to get standardised research done in influenza. And so this is just one of many examples of how it's been used by other disease areas. A new an exciting tool we've just got in development now, it's going to be launched in the next 8 weeks or so, is a process map for researchers to use. It sounds quite dull, but we think it's quite exciting. The idea of this is it just demonstrates exactly all the steps you need. You know, Natalie ran through all the challenges there are in setting up studies in these places. This is a truly globally applicable process map to any kind of research study, and it'll help you make sure you've thought of everything you need to go through. So many of us who support research in low-income settings work with people who sort of 10 minutes before the study starts say, I haven't got a database, or what about my trial lab? Or, you know, there's all these things that are missing. And this process map will make sure everything's been thought about. But much, much more than that, it dynamically points to everything you need to conduct that step. So it'll point to all the tools and resources on this platform, but also elsewhere. It will also give you peer support, help you find experts, have discussion forums. So there's going to be an awful lot on there. And if you're interested, you can learn a lot more about that as we release it. SiteFinder was another tool developed by in partnership with the Gates Foundation. We really have enjoyed putting this together. We use dating site technology for this, and the idea was that you know, there's no hospital that just works on TB, right? Or there's no village where you've just got kids with malaria. And if you did a map of where all the study sites were for different diseases, it's ridiculous. It's people who work on TB studies just go back to their TB sites. And the Gates Foundation did this exercise with a group that Natalie and I are involved with their product development partnerships. And so the challenge was there's sort of two issues that, let's say, for example, the 10 sites that worked on the malaria vaccine trial we heard about earlier, that's finished now. They've got amazing staff. They've had about 7 years' worth of investment. They've got digital X-ray machines, fantastic laboratories. They need some more studies to come in there now and use that amazing capacity that's there. Otherwise, it will just disperse, and what a waste of investment. And equally, there are people planning research studies around the world who are desperate to find these really well-experienced centres, or centres who've got the disease burden and desperately want to learn. I love working in research-naive sites that have never done a study before. They're keen to learn, they want to do well, and they just need to have a voice and to say, we're here and we want to work on whatever's out there. So SiteFinder does that. You can list yourself as a research site, and then if you're planning a study, you can list yourself up there too. And the idea is also for people to be able to find collaborators. So maybe somebody's got a fridge full of samples in Ethiopia and they just want to find people with the laboratory capacity to help them analyse those samples. It's there for that as well. So it's working really nicely. It hasn't been up that long, but it's basically taking dating site technology and applying that to improve research. We've got over 30 courses up now. I think there's about 12 core courses, and then we've got the translations. The aim of our e-learning is really straightforward. We take very high quality face-to-face training and we adapt it into online learning courses. They go out for peer review and they're short how-to courses. We've had over 10,000 of these courses completed now. It's free. They've all been developed to run on low bandwidth settings, and they work really, really nicely. And it's a very simple system. And for NTDs, we'd love to put a whole set of e-learning courses up on the NTD area. And we've got staff within our operational team to help build these. So if anybody's got any good face-to-face courses they want, or any ideas for courses in this area, let us know and we can develop those in partnership with you. And everybody who's contributed to the courses are of course recognised. And so it's nice dissemination for the lots of excellent training that's already out there. The other thing we've got is this professional membership scheme. This is another project we did with WHO TDR. Our philosophy was that most people who work on clinical trials in low-income settings just aren't recognised for the job they do. They've come from a nursing background or laboratory staff, data managers, and they're just, all the focus goes on the PI, and these are the people that make trials work and allow the question to be answered. And they need professional recognition, they need career ladders, they need opportunities. And so we've got this nice professional membership scheme where people can work their way up through 5 different levels of membership. And it's a really nice way to show how sites have grown. And we're increasingly working with EDCTP on this because it's a way to measure how you've moved research organisations up through developing their in-house capacity. And as I say, it's aimed for all sorts of people, including the investigators, but right through to your field workers. A new area we've put up quite recently is to support laboratories, and again we're going to have a whole set of e-learning courses largely developed from the good work that's gone on in Kilifi. We've heard already today about the lack of things like normal ranges that are applicable for these settings. We're working in partnership with groups like the African Society of Laboratory Medicine and GLABMAP, which was a WHO initiative to try and list laboratory capacity around the world. Again, the idea is simply to network the networks and make sure everybody can access information. And again, the process mapping tool will really help pinpoint what's available and stop people having to reinvent the wheel with things like quality management standards and so on. So, just really to summarise, it's simply a mechanism for researchers to work together without geographical, institutional, financial barriers. The idea is to help people work across disease areas, across institutions, across regions. We have research nurses in Malawi, for example, talking to research nurses in Nepal and explaining how to set up a community advisory board. That's a community of practice in action. So there's 20 different offices, if you like, in the science park now, and they're given this really high-tech area for them to work in using this cutting-edge technology, and they can just get on and do the work they need to do, and their staff and their teams can access all the other resources. We've had over 200,000 visits and 11,000 courses have now been completed. And what keeps people coming back is the extra sort of cross-cutting tools that can help them with their work, so the process mapping and the e-learning, for example. It's really important that we try and make some initiatives like this work, because we've heard all day that there's not enough research and evidence collection going on in places like this. Research is seen as being expensive and slow, cumbersome and difficult. But the things that people find expensive, slow, cumbersome and difficult are the same ubiquitous challenges that we all face. And as scientists, we're rubbish at sharing. We just don't do it. It's just not, we haven't been brought up to do that. There is a massive focus on data sharing, which is fantastic, and it's the way the world's heading. that's great. But unless we share the methods by which we collected that data, it's not going to be very much use, because we've collected data in different ways, we can't assure the quality, it's taken so long, or indeed there isn't even enough data to share. So we need to step back a bit and think about the bit that happens before. So this is, we hope, is a sort of innovative way to do it, because we're trying to use the sort of wiki-type sharing philosophy in the world that's going on. You know, with TripAdvisor, we all go on that now, don't we, to check out restaurants and what have you. It's just trying to apply that in this setting, that we should all just talk to each other. And I love that open session earlier, because that's exactly what this is all about, and I hope we can work with some of the organisations we heard about earlier. It's also that we're terrible for working in silos and vertical networks, and that hopefully we can use digital technology, because the trouble is information overload, isn't it? There's just so much out there. But that doesn't stop Amazon and Facebook and LinkedIn, does it? So it shouldn't stop us. You can organise information in a very clever way, and it's all about how you present it and how you personalise the views that people get on websites, and we can do that. So it's just a very functional digital way to just collaborate online, and it's the clever stuff behind the scenes, but hopefully given a simple presentation. So just to finish, this new area we've set up for NTDs is up online now. It's just put up there almost now as a sort of, here it is, what do you want to do with it? And I know Astrid's going to be working very hard trying to follow up with people and seeing how people would like to use it and what they'd like to do. But please let us know. You know, it's a democratic, neutral space. All we're doing is facilitating it and just putting it out there for you. So it's there for the NTD community to use. So please take up that opportunity and make the most of it. Thank you very much.